Welcome back to RhAPPcast, the official podcast of Rheumatology Advanced Practice Providers. I'm your host, Amanda Mixon, president of RhAPP. Due to the popularity of our first episode, we are back today to learn more about X-linked hypophosphatemia, or XLH, a patient's experience with this illness, and how genetics play a role in her journey. Bonnie Smeryage, DNP, FNPC, who listeners will be familiar with, is my co-host for today, helping to interview Shannon, an XLH patient and our guest. Bonnie is a paid speaker and a member of Kyowa Kirin Speakers Bureau. Shannon Sharp is a paid patient ambassador for Kyowa Kirin and has received compensation for this engagement. This podcast was developed through a collaborative educational partnership between RhAPP and Kyowa Kirin. Shannon and Bonnie, before we begin, can you each give us a brief introduction of who you are?
Thank you for having me. I'm a patient ambassador for Kyowa Kirin. I'm so excited to be here with you guys today and look forward to sharing my story with the rheumatology clinicians listening in.
Thank you so much, Shannon, for doing this. And thank you, Amanda, for having me again. My name is Bonnie Smeryage, as Amanda said. I'm a nurse practitioner at Joe DiMaggio Children's Hospital in sunny South Florida in pediatric rheumatology. And I have the great privilege of getting to take care of patients with XLH, as well as the honor of being part of the Speaker Bureau for Kyowa Kirin. So we talked about having a little bit of a review of disease state. So XLH is a chronic, progressive, systemic, hereditary metabolic disease of renal phosphate wasting. That's a little bit of a mouthful. But in our last episode, we discussed how XLH can mimic other rheumatologic illnesses, and that one of the keys to identifying and diagnosing XLH is by evaluating that fasting serum phosphorus. And some signs and symptoms of XLH that overlap with other rheumatologic diseases include like bone pain and muscle pain, ectopic calcifications like enthesopathies, osteoarthritis, can be even muscle weakness, joint stiffness, and fractures and pseudofractures. And also, I wanted to remind our listeners that XLH is an inherited X-linked dominant pattern, meaning that there is a genetic component to the condition, and that occurs on the X chromosome, and that an individual only needs to inherit one copy of that genetic variant to be affected. So both males and females can be affected by XLH. It's also important for rheumatologists to remember that 20 to 30% of XLH cases occur spontaneously with no family history of the disease. Therefore, a negative family history does not rule out XLH. And evaluating that fasting serum phosphorus that we talked about a lot last time is really critical to making that XLH diagnosis.
So I have to tell you, after our last episode that you and I did together, I found my first patient, which,
wow.
I mean, and that's what this is about. It's so meaningful because I have to be honest, I've probably missed it. No, I know I've missed it. I'm sure I have. Because I didn't know what to look for. And so I think just having episodes like this where we can learn, because I do think a lot of these patients end up in our clinic with this kind of unexplained bone pain or potentially thought to be maybe fibromyalgia, etc. And I think we're missing this. So I just want to start by saying thank you so much because you taught me and I know our listeners, and I think it truly will help our patients. Thank you for providing the recap on XLH from our last episode. And I'm so excited to have Shannon with us today. It's not common that we get to actually interview a patient on the podcast. Fortunately, I was able to interview one of my patients a while back. So it's definitely something I want to do more and more of because I think you add such a wonderful perspective and it can totally teach all of our listeners, which range from, I think, some patients to APPs to physicians. So with that, let's just jump right in. So to start, Shannon, can you give our listeners a background on your early experience with XLH?
Sure. I was diagnosed when I was 1, and back then they didn't call it X-linked hypophosphatemia or XLH. I was diagnosed with vitamin D resistant rickets. So my father and his mother also were affected. we've tried to trace it back, and that's as far back as we could go, so we think she was probably a spontaneous case. My grandmother never talked about XLH, and that's probably why we never talked about XLH as an extended family. But I was extremely grateful that I did have my dad that I could go to ask for advice on how to manage my XLH symptoms. But I still felt like there was parts of my experience that he couldn't quite understand because I was a female and he wasn't my age. When I did talk to my dad about our XLH, we mostly talked about how he managed his symptoms or what he did to fit in when he couldn't do all the other things the kids were doing. Like he took up swimming instead of doing more physical activities.
Is there, was there anybody else that you could speak to about your disease at the time? Like, did you have any conversations with other healthcare providers?
There were some healthcare providers that I did lean on, but early on, I felt like there were questions I really couldn't ask, especially to my family. So I kind of manufactured my own explanations. And in my brain, I picked up on a possible genetic pattern in our family because my dad was the second child and I was the second child. So in my preteen years, contemplating my future, I decided I was never gonna have more than one biological child. I thought that the first child would be spared from XLH and the second child would inherit the disease. Looking back on it now, I know that's silly logic, but when I was probably about 13, my town hosted these traveling medical students who came and stayed a week with different families, and they would perform wellness checks for the community. And I remember those, students coming to my parents' restaurant and sitting down with me, and as we were talking, they were asking me questions about my XLH, and I shared my experience, what meager experience it was about the genetics, and, that was the first time they explained to me how XLH was passed from one generation to the next to the X chromosomes and I would likely have a 50-50 chance of having a child with XLH. I also learned that XLH was inherited from a father. He would only pass it to daughters and not pass it to sons. But with a mother, she has a 50-50 chance of passing it to any child.
Wow. I mean, to hear all of that at such a young age, how did you feel about receiving all that information?
To be honest, it rocked me to my core. I um I was gonna have to wrestle with the idea of having to choose between a mom, which I so desperately wanted to be, or taking the chance of passing it to a child.
Sounds like you went through so much as a young adult living with XLH. How did you navigate that as you got older?
As I graduated high school, I reflected on the experiences I had as a patient with my XLH, and I decided I wanted to become a doctor. And I remembered how it felt to be educated about my disease as I talked to those medical students and who visited that summer. And I wanted to pass that experience on to future patients. And I also wanted to make sure that other patients and doctors understood that XLH was a genetic hereditary disease. But while I was in college, I met Robbie and we started dating. And I was very open with him about my XLH and the genetics of the disease. He was so compassionate and understanding as I shared my experiences with him. And wasn't long after that, we got married, and I became an instant stepmother to his two children from a previous marriage. And I love them more if I couldn't love them more if they were my own flesh and blood. And if you ask them today, they would tell you that I'm their mom.
Well, if I can jump in, Shannon, I haven't had a patient yet that's grown into adulthood, but this is a discussion that really happens as patients get older and into relationships. So, how did your XLH impact your family planning and other decisions about your future? I'm so interested in what you have to say.
Well, through the years, Robbie and I had several discussions about whether we wanted to grow our family. I admitted that I didn't want to pass my XLH to a child because of how hard it had been for me and my family. And Robbie was so sweet. He said, "Shannon, I love you and you have XLH. If we have a baby who has XLH, we'll love that baby too." And even though we didn't end up having any biological children, I was grateful for his compassion that he showed me when we discussed the possibility of not having any more children. More than that, I'm grateful that I was able to live out my dream of being a mother, even if I never had the experience of being pregnant or childbirth. As I navigated the challenges of marriage and motherhood, I decided that medical school wasn't a good fit for my family. So I switched my major to business, which I had the intention of helping on the business side of medical practices. And that ended up being the perfect choice for me because I managed a physical therapy office and they were flexible and understanding when it came to my XLH. I remember sitting in my comfy office chair and remembering the days at my parents' restaurant when I was growing up, and I was so thankful that I had a less physically demanding job than my dad's.
Wow, yeah. A physically demanding job, I think, is really tough with anyone with XLH. And so but I really hope that patients don't feel limited to what they can do, specifically, even with really strong support like you had, which is really critical for anyone living with chronic disease, especially for somebody living with XLH. So, was there anything that you learned from your dad about managing the disease or experiences that shaped how you see XLH?
Yeah, so it wasn't easy for my dad. I remember him talking about going to the doctor and his doctor suggesting him have neck fusion surgery to treat his spinal stenosis. He'd been having vertigo and headaches and tingling in his hands and feet, which impacted his balance, which led to a fall. Instead of treating the doctor's treatment plan as seriously as he probably should have, my dad had brushed it off because he didn't feel like he could take off 4 months to recover from the surgery. He was always taking care of us as a family, and he didn't want to become a burden. Looking back on that now, I kind of wish we had realized what the consequences of putting off this surgery could have been. My dad had been my hero, and he was the one who needed us now. Once he fell, he ended up having to have that surgery just as an emergency surgery. Overnight, our family had to scramble together to put together a plan to keep our restaurant afloat while we helped my dad recover and reorient to his new life. We had to worry about whether the house was handicap accessible, we could get the wheelchair in there. We got him a voice activated remote for his television and his phone and his laptop to help him feel more independent. But my weekends were no longer the opportunity I had to recover from my work week. I had to fill in for my parents at the restaurant. And I definitely got a new appreciation of all the sacrifices he'd made for our family when I was so bone weary that I had to drag myself to the car to go home at the end of each of those shifts. Eventually, we sold the restaurant and my parents retired. Even though life was never the same after my dad's fall, we fell into a normal routine, just like anyone else that has to navigate a new disability.
Wow. Well, it sounds like your dad was really lucky to have you and your whole entire family around. And I think that's really critical for patients with XLH to have all that extra support. I know that unfortunately, adults with XLH often require orthopedic interventions and other surgeries and procedures, and they have physical impairments as a result of the condition that really uh, reduces their ability to work and potentially contributing to possible unemployment and disability. With my care of pediatric patients, I haven't experienced that, but all throughout my career, I've seen patients with all differing levels of function, similar to what's seen in other rheumatologic conditions, where we'll see patients have varying levels of function. So, multiple surgeries are also something that these patients go through. And it sounds like you and your family were not spared that either. For example, I had one patient's mom who had 15 different orthopedic surgeries, and each one required rehab and each one required time off of work. And while the patient's normal function would go down during the time with rehab, she was able to regain and some of her strength and really become more normal. And this is why longitudinal care is really so important for our patients, that we meet them at every stage of the process. And the reality of XLH, and just like you were saying, Shannon, is that it is very challenging. And as healthcare providers, we really need to be there for our patients to support them. So, can you share some of your ups and downs of your journey and any support that you had to help us understand as providers?
Yeah. So, in 2009, Robbie and I were surprised. We got full custody of our 18-month-old grandson, and running after a toddler was definitely challenging when I was in my mid 30s. Definitely more so than I had remembered, especially with me having XLH. I remember being a parent was not as taxing in my 20s when my son and my daughter were young. I was able to do more of the physical activities with them, like taking longer walks or doing playing with them outside and doing games. But raising my grandson, I've really seen the challenges of the progression of my XLH. Like I couldn't walk with him in the parades with a scout troop or go on class field trips with him in elementary school, or even go outside and play ball with him. It was just too difficult. The disease progression was starting to take its toll on me, and I couldn't help but to think that, I might end up like my dad. My dad passed away in 2013, and it left a huge void in my life. I just turned around 40, and my symptoms were really, really starting to progress. I remember my pain level, my fatigue, and the lack of mobility were the worst that ever been in my life, which helped me better understand some of the sacrifices my dad had made for our family when I was growing up, and he worked at our family restaurant. And eventually in 2017, I started getting some of those headaches and vertigo and the sensations he'd had. The symptoms were really difficult to manage. And when I saw the doctor, he ordered some imaging and then said, "You have the worst case of spinal stenosis I've ever seen."
Oh my gosh, that sounds like such tough, tough news to receive, especially given your experience with your dad's symptoms. So how did you decide to proceed?
In the back of my mind, I knew this was probably the same conversation that my dad had had with his doctor, but I just really couldn't go there yet. I remember looking at my doctor and asking for his suggestions. And when he said surgery, I was just like sat there and I was like now? He was patient and he explained that putting the surgery off could increase the chance of me falling and risking paralysis like my dad. And then the worry and the trauma of my dad's paralysis just crashed all over me in a new way. And then when I went home, I just completely lost my emotions. I was worried I'd become a burden to my husband, even though I would have gladly taken care of my dad longer if it meant getting more time with him. I didn't want to put my husband, Robbie, into that position if we could avoid it. Though I couldn't see it at that time, one of the silver linings of my dad and I both having XLH was I knew the potential consequences of not scheduling that surgery. So my husband took off a month of work to help me through surgery and help me through recovery. And then my coworkers, they took turns bringing us food every day for a couple of weeks.
The burden of XLH is lifelong and multifaceted. It includes a potential need for mobility aids, surgical intervention, as you talked about. So, how have you been since your surgery and how has your life changed?
Well, I actually recovered pretty well from my surgery, but it came very clear to me that I needed to retire from my job and apply for disability because I just couldn't work a whole day and my XLH was progressing. However, it doesn't hold me back. I am still active in my XLH community that actually has become my passion. And I'm still able to have my adventures with my husband and my grandson. And I've given in and I do use a mobility scooter now so we can go for those long walks like we like to do. We like to go to historical sites and I've loved to see the history come alive for my grandson when we go places like that.
Wow. Wow, Shannon. So, what would you think would be the best thing for rheumatology APPs to take away from your story about XLH? What advice would you have for us?
Well, I hope that when you hear my story, you recognize the importance of asking about family history in XLH diagnosis and symptom management. I've heard so many passionate debates about whether or not parents with XLH should have children. If there's one piece of advice I could pass from my experience, it would be to keep in mind that any discussion about growing a family is deeply personal, especially when it's navigated with the possibility of passing along a genetic disease like XLH. So be kind when and if the sensitive subject comes up. Recognize that if somebody is bringing this up to you, that it's a sign of trust, and please treat it accordingly. And then also encourage your patients to have conversations with their family about the genetics of the disease. Do a detailed family history to see if symptoms go further back in your family. Share the XLH specialist finder and the doctor discussion guide with them. After all, XLH has been called many things in the past, and these tools might help them advocate for themselves when partnering with their doctors to manage their symptoms. Encourage your patients to complete genetic testing, even if they are a family member or a caregiver without symptoms. The knowledge gained from genetic testing could help prepare for the future in a variety of ways.
I think these are all great recommendations. Thank you, Shannon, for sharing your story with us. I think it's, again, so impactful to hear what it actually is like for someone to go through this and their family to go through this. Bonnie, is there anything else you would like to add?
I think just piggybacking on what Shannon just said and how important family history is, that it's really one of those really significant keys that we use to diagnosing XLH. And to ensure that XLH is captured with the family history, rheumatologists should really ask about a variety of questions like fractures, pseudofractures, especially fractures that are a result of non-traumatic injury. And then, especially in the lower extremities, any leg deformities, and the use of walking devices. And I know that's a lot of questions, and a lot of the questions sound really the same, but just kind of really asking all those in-depth questions multiple different ways. Just like Shannon said, the disease has been called so many different things. And so I think that going around that in the family history is really important. And then also remembering, like we said, 20 to 30% of cases can be spontaneous. Just like Shannon believes through her family history, it was your paternal grandmother, right? That and she might have been a spontaneous case. And then the genetic analysis of that FEX gene can be used to confirm the diagnosis and that extra really step. I think, just bringing home the topic that we talked about so many times, Amanda, is that those signs and symptoms of XLH really do overlap with so many of the diseases that rheumatology is seeing and are experts in. And so that really, if you are in a practice where you're seeing bone and joint and muscle pain, those patients really can be XLH, especially with any enthesopathies and osteoarthritis, muscle weakness, joint stiffness, as we talked about at the beginning of the podcast. And even back to episode 1, reviewing it, because I feel like we talked about so much in that episode. It was so heavy. But there's just so much information there. We talked about a lot of common misdiagnosis and clues that APPs can use to differentiate XLH from the other things that we see.
Well, thank you again, Shannon. We're so grateful to have learned from you and really wish you all the best. A special thank you to Kyowa Kirin for their continued support of APP education. If you're looking for more short-form education on XLH and other rheumatologic conditions, be sure to check out the content room at rhap.org, where we offer concise, high-yield learning to keep you informed and up to date. As always, don't forget to subscribe to RhAPPcast and share this episode with your colleagues. Thank you for listening, and we will see you next time.